My name is Adam Thaler, and this is my physical assessment for the Health and Assessment class at Rowan University.
My name is Amy Thaler, and I give my consent to be videotaped.
Okay. First, we're going to start our physical assessment with our eyes. I'm going to inspect for confrontation, her conjunctiva, sclera, pupillary light reflex, any extraocular movements, and her corneal light reflex. So first, we're going to inspect her sclera and conjunctiva. It is white, it is clear, there are no abnormalities, no noticeable veins. Conjunctiva, like I said, is white, no yellowing noted. Pupillary light reflex. We have a positive pupillary light reflex in both eyes. Corneal light reflex is symmetrical with a positive reflex in both eyes in the same position. We're going to be checking for any extraocular eye movements. So I'm going to ask her to focus on my fingertips in 6 points. Please just follow with your eyes, not with your head. Alright, so we have good eye movement, no extraocular eye movements noted at this time. We're going to check for confrontation, confrontation. I'm going to ask her to focus on the spot over my shoulder. And when I bring my finger into the field of view, please focus on that. Okay, so we have a good pupillary reflex on that. We're going to now also check for confrontation also. So I'm going to cover my eye. Please cover your right eye. I'll cover my own. Please let me know when you're able to notice my finger coming into your field of view.
Now.
Okay, same with the other eye, please.
Now.
Okay, so we have good peripheral vision in both eyes. Moving on to the ear. Outside of her ear, pinna is clear. The skin is smooth. There's no noticeable masses on her ear. No redness, no swelling, no tenderness. With palpation on both ears. We have noticed one piercing on each lobe of each ear. Checking her inner ear with the otoscope. Pulling her pinna up and back. Inner ear is clear. Able to visualize the tympanic membrane. It is gray and pearly with a positive reflex of light. Checking her right ear. Is the same. It is clear. There's no foreign bodies. Her tympanic membrane is also gray and pearl on the other side with a positive reflex. Looking at her nose, from the inspection on the outside, there's no lumps, abrasions, swelling, any problems with breathing. None. Please look up to see it. I'm going to now inspect the inside of her nose. It is clear and pink. No deviatum septum noted at this time. A whisper test will be done. Please repeat the word if you're able to hear it. 99.
99.
Very good. Going to palpate her sinuses. Please, any pressure noted or pain when I palpate?
No.
They do not feel swollen at this time. Now going to inspect her mouth. Open and say ah, please.
Ah.
Mucosa is pink, moist, no lesions noted. Tonsils are +1. Teeth are lined, clean. Unable to visualize the Stenson gland at this time. Going to palpate her tongue. Open, please. Stick out your tongue. Tongue is smooth, white, no lesions noted at this time. Going to now inspect her head. And we're going to palpate for her cranial lymph nodes. Lymph nodes are not very well palpable. There is no swelling noted at this time. No tenderness upon palpation. Going to palpate her trachea. Trachea is midline. Carotid artery palpation. We have a positive pulse on the left and a positive pulse on the right. Going to auscultate for any bruits. There are no bruits heard upon auscultation. I'm going to check range of motion of her neck. Could you please put your chin to your chest and then back to your neck, to your back, and look up at the ceiling, and put your chin to your left shoulder and to your right. So we have good muscle strength, good controlled smooth motion. We're going to now inspect her thorax. Visual inspection, anterior, posterior. We're going to start with the anterior or posterior part of her back. I'll move over to this side. Her skin is smooth and pink. It is clean, dry, and intact. There's no lumps or abrasions noted. Palpating her back. There's no lumps or masses noted. We're going to percuss. We're going to assess for tactile fremitus. Please say the word 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
And again.
99.
Checking her costal angle. Hands on the back. Please take a deep breath. Okay, so we notice a symmetrical separation of the thumb with an inspiration for her costal angle. Going to now auscultate her lung sounds. Deep breath, please. Again. 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 And again. Also want her to ask, we're going to assess for egophony. So could you please say the E sound, long E.
E.
Again.
E.
Again.
E.
Again.
E. E.
One more time.
E.
Very good. So we have good egophony. Going to assess her anterior part of her chest. Inspection. Skin is smooth, pink throughout. There's no apparent lesions, scarring noted. Palpation. Reveals the same. No masses noted at this time. Going to percuss. And we're going to auscultate. Deep breath, please. And we're also going to assess for her angle also. Deep breath. Okay, and we have a good symmetrical separation of the thumb with inspiration for that. We're going to move on to the heart. We're going to do just a visual inspection as we did for the thorax. Skin is, like I said before, smooth, pink throughout, no lumps or masses noted. We're going to auscultate for heart sounds. Auscultation of the heart, able to identify S1, S2, no extra heart sounds heard, no S3 or S4, no gallop or no murmurs or pericardial rubs heard at this time. We're going to inspect her abdomen. We're going to ask her to lay back. We're going to do a visual inspection of her abdomen. Smooth as skin, it is dry, clean, no visual lumps or masses noted. We're going to auscultate. We have positive bath sounds in all 4 quadrants of our abdomen. Palpation, light palpation. No lumps or masses noted at this time. Be able to palpate deep and feel the edge of her liver in the right upper quadrant. And the spleen in the left upper quadrant. Okay. We have you sit up, please. Going to try and attempt to palpate her kidney. And I'm unable to identify at this time. One more time, I want to ask you to lay back. I want to assess for a Murphy sign. Any pain upon release?
No.
Okay. Negative Murphy sign. So I have to sit up. Okay. I'm going to move on to her musculoskeletal. We're going to assess her joints. We're going to inspect. We have asymmetry in her upper joints, in her shoulders, in her elbows, and her wrist. There's no swelling or redness noted. Like I say, symmetrical throughout. Going to palpate. Noticing any kind of tenderness, lumps or lesions, mass is noted. Okay, so we're going to assess her range of motion. If I could ask you to stand up, please. And I want you to bring your arm up above your head.
Which arm?
Your left arm up above your head, and then straight down, and then up behind your back. And bring your inner elbow up into the middle of your back, like so. And do the same with the right arm, please. And back down, and back, and up. Very good. So we have good range of motion of our upper extremities and arms. Bring your arms up to your shoulders, and down, and hold your arms out, and turn your wrists into inner and outer. Okay, so very good. So you can have a seat. So we have good range of motion with our upper extremities and joints. We're going to palpate for pulses. Straighten your arm out for me, please. We have good radial and brachial pulses in the right, +2. And we have +2 pulses in the left arm also. Assessing for the pulses in her feet and lower extremities. We have a +2 pedial. Positive +2 dorsal pedius. And a palpable +2 popliteal. +2 popliteal and dorsal pedius in her left lower extremities also. Okay. I'm just going to ask you to stand one more time. I need to bend over. Ask you to bend over. I want to check your spine for any scoliosis. Spine is midline. There's no deviation of her spine at this time, so she'd be negative for scoliosis. Thank you very much. Please sit back on the table. All right, so we're going to assess for a bulge test. Ask you to lay back, please. We're assessing for a bulge test. There is no fluid noted in her right leg. And no negative bulge test in her left knee also. Could you sit up, please, for me? Okay. We're going to assess for her cranial nerves right now. So I'm going to ask her to do a few things. I'm going to ask her to smile, stick out your tongue, blow your cheeks. Very good. We did the whisper test earlier, which she was positive. She was able to identify the word that was whispered. I'm going to assess her tongue, open up, say ah. Can you yawn for me? Very good. Good, that would be 9 and 10. Cranial nerve 11, shrug for me, please. Okay, turn your head to your left. And turn your head to your right. Good muscle resistance. That would be for cranial nerve 11 and 12. Actually, tongue thrust. Stick out your tongue for me, please. Okay. And say light and tight.
Light and tight.
Okay. So we have a positive cranial, no deficits noted in cranial nerve number 12. So we're going to do some rapid alternating movement. I would like you to touch your thumb to each of your fingers and then alternate back the other way. Very good. And with the other hand also. Okay, so that would be the rapid alternating movement. Coordinating test, I would like you to put your finger to your nose. Close your eyes, hold your arms out. Close your eyes and finger to your nose, please. One more time with your other hand. Thank you. So she has good coordination with the finger to the nose test. Could you stand up for me, please? I'd like you to close your eyes and hold your arms out to your side. Tilt your head back. We're assessing for any kind of drifting. No drifted noted. Very good. You can have a seat, please. Thank you. I'd like you to lay back and put your heel to your opposite shin, please. And do the same with the opposite leg. Okay, very good. Thank you very much. So we have a good heel to shin testing right then. I'm going to have a couple objects here. I have a broken tongue depressor. I'm going to ask her to close her eyes and ask her to tell me whether or not she feels a sharp side or a dull side. So if you could close your eyes, please, and let me know what you feel.
Dull.
Is it sharp or dull?
Dull.
Okay.
Sharp.
Okay.
Dull. Sharp.
Okay.
Dull. Sharp.
Okay. So we have a good sensory test. Notice that she's able to identify sharp and dull objects. A vibration test. Tell me when you can no longer feel the vibration.
Stop.
Okay. And we're going to assess the other leg. Once again, just tell me when you stop, when you do no longer feel the vibration.
Stop.
Okay. So she's able to identify vibration on dense bone. I'm going to ask her to close her eyes, and I'm going to move a series of her toes in a position. I'm going to ask her to tell me whether if I'm moving that up or down or sideways. So if you can close your eyes for me, and I'm going to move your big toe in a direction. If you can tell me which way it is.
Up. Down.
And on the right leg.
Up. Down.
Very good. Okay. We're going to assess for graphophoresis, which is I have an object in my hand here. Please close your eyes. Do not look at the object. Hold your palm out. And I want you to be able to identify what this object is in your hand.
Paperclip.
Very good. She's able to positively identify that I placed a paper clip in her hand. And then I'm asking her to also close her eyes, and I'm going to draw an object in her hand. I want her to be able to tell me what that object that I'm drawing in her hand is.
Circle.
Very good. She was able to identify that it was a circle that I drew in her hand. I'm trying to think what else we have to do here. Oh, range of motion in her lower extremities. If I can ask you to lay back one more time, I apologize for going out of order. Can you raise your leg straight up in the air? Left leg?
Oh.
And right leg straight up in the air. Please bring your knee to your chest. And with the other leg. Okay. Sit up for me. And with your ankles at your feet, please bring your ankles, do a pronation, and with your ankle, bring up and to the side, and interior and exterior. Very good. She has good range of motion in her lower extremities. I believe this would conclude the physical assessment, and I thank you.